Now to health concerns. Medical experts and healthcare professionals have urged Nigerians to ensure proper diagnosis before commencing any treatment, stressing that accurate medical diagnosis is crucial for effective treatment. This call was made on the sidelines of presentation of ISO accreditation certificates to selected laboratories in Nigeria. The experts cautioned against dangers of self-medication, highlighting that it can result in incorrect treatments, worsening health conditions, and contributes to development of drug resistance. In this special report, ADBN's health correspondent, Bere Obong Achibong, tells us more.
Proper diagnosis, they said, is essential for personalized care and optimal recovery. They emphasized that a thorough diagnosis ensures appropriate treatment plan is implemented, resulting in better health outcomes and preventing unnecessary procedures. National Laboratory Manager at Everite, Dr. Aleke Aloysius, emphasized that proper diagnosis is crucial before any medication, urging Nigerians to ensure accurate diagnosis prior to treatment.
Laboratory plays a very important role in healthcare, and diagnosis is key point. It is only when one is diagnosed of a particular disease, confirmed, that it is expected that one should go for medication. Gone are the days one should just wake up one day and go to the side kiosk where they have drugs to pick. It is better to have knowledge of what is wrong with you, and then you go for the right medication prescribed by the right healthcare professional. It is very important that we engage the public to let them know the disadvantage of taking drugs anyhow. Of course, that has led to what we call in the laboratory multi-drug resistance.
Consultant family physician, clinical dermatologist, and medical director at Buhari General Hospital, Dr. Migi Yawan Ibrahim, highlighted risks of self-medication and its potential dangers, while laboratory manager at Buhari General Hospital, Mrs. Constant Agulanna, called on the government to establish a robust health insurance system for Nigerians and regulate cost of reagents to make healthcare more accessible.
The risks are open to all. Self-medication, people taking medicines without having to get diagnosed. Diagnosis, I mean clinical diagnosis, followed up, backed up by laboratory diagnosis. Now, it is not just any laboratory, competent laboratories. And then the laboratories are in levels, There are some that are just basic, that can just test one or two things, and then there are specialist laboratories. It's very obvious, really, the dangers of self-medication or taking herbs and other things without laboratory testing. And then while the dangers also of patients on treatment not being followed up by tests.
Okay, I think the first thing that the government needs to do is to establish a robust health insurance for everybody, not just for government workers. As far as you are a Nigerian citizen, there should be a health insurance for all. And then, of course, if by the time there's a health insurance, the government will be forced to also regulate the cost of those reagents, even have a form of a policy that is going to guard even the producers, the manufacturers of those reagents. I think it's just all about the government helping to do that.
On his part, Minister of State for Health and Social Welfare, Dr. Isiaq Salako, also called on laboratories and health facilities operating without proper licenses to cease such practices, stressing importance of regulatory compliance in maintaining healthcare standards.
And we're sending a very strong signal out there that if you are practicing without licensing, either as a facility or as a professional, you must start packing your bag and baggages out of the system.
Self-medication poses significant dangers as it can lead to incorrect diagnosis, inappropriate treatment, and worsening health conditions. It is crucial for individuals to seek professional medical advice and undergo proper diagnosis to ensure safe and effective treatment. Bere Obong Achibong, ADB.